So today we will see the another atypical lumbar vertebra, which is fifth one. Okay. Before starting the class, you all know there are how many cervical vertebra? 7. C1 to C7. Then thoracic is 12. Then this is your lumbar, and this is your sacral and coccyx. Okay. So now what is the difference between the cervical, thoracic and lumbar? Okay, you all know that the cervical, after the class I will ask question. Okay, if you fail to answer then you mark absent. Okay, so listen, see, they are look like same but they have some differentiating features. Okay, this is your cervical, thoracic and lumbar. So what is the difference? First, see, this is your body. Okay, and this is the body of your thoracic and body of the lumbar. So see, there are difference. The body of the cervical vertebra, it is quite small as compared to your thoracic and lumbar, but in case of the thoracic it is kidney shape, oh sorry, heart shape. Okay, but in case of the lumbar it is kidney shape. Okay, so by looking the body you can tell this, sir, this is your cervical, thoracic or lumbar. Next is your, what is this called, this part? Vertebral foramen. Okay, see, the vertebral foramen is triangular in shape in case of both cervical and lumbar, but the cervical vertebra, the size is more as compared to your lumbar. Okay, but in case of your thoracic it is round in shape. So your vertebral foramen in case of cervical and lumbar it is triangular in shape. Okay, but what is the difference between these two? The cervical is, the foramen is quite bigger as compared to your lumbar, but in case of thoracic it is round in shape. Okay, next is, see, there are one, this is called your which process? Transverse process. Okay, see, here foramen is present, it is called foramen transversalis. This is absent in case of your thoracic and lumbar. Okay, so first is body, then the foramen, then transverse process. By looking this, you can identify this is your cervical, thoracic and lumbar. Okay, you all know what is the main function of your cervical? The neck flexibility or your movement of your head. Okay, another is thoracic, it is mainly from your thoracic cage. And what is the main function of the lumbar? They carry the upper body weight. Okay, so if you want you can write it down, the difference between the cervical, thoracic and lumbar. Okay, another difference are present. You all know in the thoracic vertebra there are costal facets is present. Okay, superiorly, superior costal facet, inferior costal facet and transverse costal facets are present. Here your ribs are attached. Okay, so this is the present only your thoracic vertebra. Okay, these things are absent in case of your lumbar and cervical. Okay, now you can write it down, don't take photo. If you write you can remember all those things. Simply write the cervical, thoracic and lumbar. The body of the cervical as compared to other it is small, and in case of thoracic it is larger and heart shape, and in case of your lumbar it is huge and kidney shape. And next is your spinous process. Always remember, in case of your cervical and thoracic the spine is downward. Okay, but in case of your lumbar, see, this is straight and quadrilateral in shape in case of lumbar. Okay, only write first 4 points. First is your body, spinous process, vertebral foramen, then transverse process. Write simply. Okay, like your vertebral foramen, this is foramen is mainly triangular. In case of thoracic it's circular, and lumbar also triangular, but the cervical, in case of cervical thoracic vertebra the vertebral foramen is quite larger as compared to your lumbar. Now recap the previous class. Okay, so first is, what are the parts of your lumbar vertebra? This is only typical one. Okay. What is the parts? First is body. Okay. So this is the body. Okay. And this is the arch. Okay. So body is bean shape. Okay. Or kidney shape. And transversely it is more as compared to your anterior posterior diameter. Okay. And see the anterior surface is more bigger as compared to your posterior. So see the length of the body is slightly greater anteriorly. So this contribute the forward convexity. Okay. So body is like this na, this back region. So for this reason these things are happen. Okay. This contribute the forward convexity. The next, this is your vertebral arch. Okay. So it is formed by, this is called pedicle, this is lamina, and this is your posterior surface of your body. So by these three, this vertebral arch is formed. Okay. So both side vertebral arch from one foramen, it is called vertebral foramen. Okay. And there are process. Now the process. Okay. So how many process? This is called your transverse process. Okay. It is thin and tapering. Okay. Here posteriorly, see posterior inferiorly another process is present. It is called accessory process. Okay. So transverse process, accessory process. Okay. And this is called your superior articular facet. Okay. And this is called your inferior articular facet. Superior articular facet is concave and directed posterior medially. Okay. Or backward medially. This is called your inferior articular facet. This is convex and directed anterior laterally. Okay. And here the superior articular facet posteriorly you can see another depression is present. This is called your mammillary process. Okay. And one thing you remember, the distance between the superior articular facet is more as compared to your inferior articular facet. Okay. So this is mainly the features of your L4 vertebra, means L1 to L4 vertebra. Okay. If you want, you can write simply the size of the body. Always remember the size of the body increasing from the downwards. Okay. So the size of the body increasing progressively first to fifth. Okay. So by looking the size, okay, you can differentiate it. Which one is L5 or L4? Okay. Because see, this is your L4 vertebra. Here the size of the body is more as compared to this. Okay. So write the size of the body increasing progressively from the first to fifth, and the length of the body is slightly greater anteriorly. So this contribute forward convexity. Next is vertebral arch. It is formed by posterior surface of the body, pedicle and lamina. And two side combined, it is from one foramen. It is called vertebral foramen, which is triangular in shape. Okay. Now focus on today's class, how you differentiate it from your L1 to L4 or typical from atypical. Okay. So this is mainly your L5. Okay. By looking the body, okay, the body is huge in shape as compared to your L4. Okay. So similar only. This is bean shape or kidney shape. The transverse diameter is more as compared to your anterior posterior diameter. Okay. But here you can see this is your transverse process. But here in the L4 you can see the transverse process is thin. Okay. Thin and tapering. But in case of your L5, it is thick and pyramid in shape. Okay. This is thick and pyramid in shape. And here what structure is present? Pedicle. Okay. So in case of L5, the transverse process is covered your all pedicle. Okay. Means encroaches all the pedicle part. Okay. But in case of, see, the pedicle is separate here, you can differentiating. But here the transverse process is pyramid in shape and it is encloses your pedicle. Okay. And by looking the spinous process, see, here spinous process is straight, but here the spinous process is not straight. This is small, thick, and the tip is rounded in case of atypical lumbar vertebra. Okay. So first is body, then this transverse process, then the spinous process. Then always remember, this is called your superior articular facet. The superior articular facet here present more posteriorly than medially, okay? Means it is present more posteriorly, okay, than medially. And this is called your inferior articular facet. This is present more forwardly or anteriorly as compared to your laterally, okay. So this is present more posteriorly, this is present more anteriorly. Another differentiating features is, this is called your inferior articular facet. Always remember, the distance between the two inferior articular facet are more in case of your L5 vertebra, but in case of L4 the superior articular facet distance is more, but in case of L5 the inferior articular facet distance is more or similar to this, okay. So this is the mainly the differentiating features, okay. Now write the features of the atypical fifth lumbar vertebra. First is the transverse process. See, the transverse process is thick, pyramid in shape, and their base attached to whole of the thickness of the pedicle. Means the transverse process is attached to your entire pedicle, okay. This is the transverse process attached to your entire pedicle. And the spine is short, small, and tip is rounded, not quadrilateral in shape. Next is your body. You all know the body is largest of all the lumbar vertebra, and the vertical height means the anterior surface is more as compared to your posterior surface, okay. Next, write the inferior articular facet. The distance between the two inferior articular facet is more as compared to your superior articular facet, okay. So there are 5 points, okay. Mainly first is body. Body is huge, okay, as compared to your L1 to L4. The next, the spinous process is small, short, and tip is rounded. Another is transverse process. Transverse process is thick, and this is encroaches or means covering your all the pedicle, okay. The next is, this is your superior articular facet, inferior articular facet. In distance between the two inferior articular facet is more as compared to your distance between the two superior articular facet. And the superior articular facets look more backward than medially, and inferior articular facet look more anteriorly than laterally. So this difference is very much important, okay. If you know this difference, your 80% job is done, because here all information are given, okay. And what is the difference between the first is, you all know, the typical lumbar vertebra, the size of the body in the typical lumbar vertebra is less as compared to your fifth one, okay. And the transverse process is thin and tapering, but in case of the atypical it is thick and pyramid in shape, and it is attached the entire pedicle. This is your pedicle attached to your entire pedicle, this transverse process. The next, the spinous process is quadrilateral and thick in case of the fourth one, means typical one, but in case of fifth one, the spinous process is short, and see, this is not quadrilateral in shape, the tip is rounded, okay. Next is superior articular facet distance. Distance between the superior articular facet are more in case of the L4, but in case of the L5 the inferior articular facet distance is more, distance between these two inferior articular facet, okay. Next is clinical anatomy, okay. First is sacralization of the fifth lumbar vertebra. So what is the meaning of sacralization? See, there are L1, L2, L3, L4 present, but L5 is not present, because L5 is fused to your sacrum bone. So this is called your sacralization of the fifth lumbar vertebra. So the fusion of the L5 vertebra completely or partially with your sacrum bone, it is called sacralization of the L5, okay. In many cases, the transverse process of the L5 may articulate with the L of the sacrum or the ilium and compress the fifth spinal nerve, okay. So what is the meaning mean? The L5 is fused to your sacrum bone. So this is called your sacralization of the fifth lumbar vertebra. Next is lumbarization of the S1 vertebra, okay. See, this is your L1, L2, L3, L4, L5. But here what's happened, you all know the S1 to S5 are present fuse, okay, but in case of the sacralization, the S1 is means look like your lumbar vertebra, okay, means the S1 is separate from this fuse one, okay. So here S2 to S5 is fused, but S1 is not fused, okay. So see the line, the first sacral segment is loose and behave like your another lumbar vertebra, okay, means L1, L2, L3, L4, L5, and here look like same, but this is your S1, okay. S1 is separate, so this is called your lumbarization of the S1 vertebra. So when the S1 vertebra is no longer joined with the rest of the sacrum, instead it is partly or completely fused with your L5 vertebra. So what are the symptoms? Mainly the backache, okay, this is the main symptom, means the S1 is separate from your fuse one. This is called lumbarization of the S1 vertebra. Next is Spina Bifida, means this is mainly the development anomaly. If the fusion of the two vertebral arches if not properly happen, so if you all know from this vertebral foramen what structure are passes, meninges and spinal cord. So this is exposed and here protrusion occur or hernia occur here, okay, because this is direct contact, because these things are not developed, okay, that's why these things happen. This is called your spina bifida. So it is occur due to the non-fusion of the two halves of the vertebral arch. This is the vertebral arch are not developed properly. So in this condition, the meninges and spinal cord are exposed, so and may herniate. So this is your spina bifida. Next is spondylolysis. Lysis means breakdown. If the vertebral arches break from your body, this is called your spondylolysis. These things are happening in many injuries or road traffic accidents, okay. So this is called your spondylolysis, means in this condition there are separation of the body of the fifth lumbar vertebra from your vertebral arch. Now next is spondylolisthesis, means it is a forward slipping of the fifth lumbar vertebra over the sacrum, okay. So in many times the inferior articular process, lamina and spine of the L5 vertebra are separated from the rest of the vertebra which is slip forwardly, okay, over the S1 vertebra. So this is called your spondylolisthesis. You all know this is the lumbar lordosis. If it is occur more, then the back is curved more, okay, more curved, okay. So this is called your lumbar lordosis. Anterior convexity of the lumbar vertebra may get exaggregated, leading to the lumbar lordosis. The next is lumbar puncture, okay. It is a procedure, it is also called the spinal tape, okay, where one lumbar puncture needle is there. It is inserted in the lower back to collect the CSF, cerebrospinal fluid, for diagnostic or inject any medications, okay. See, and this is done between your L4, L3, L4 or L4, L5. In between this needle is inserted, okay. So if you means you can pierce this all those structures, then you can find your CSF, because CSF is present mainly subarachnoid space, okay. So first is skin, see this is the skin, then subcutaneous tissue and fat, the next is supraspinatus ligament, another is infraspinous ligament, then ligamentum flavum, then epidural space, dura mater, arachnoid mater, then subarachnoid space. From this you can collect the CSF, okay, and this is present mainly L3, L4 vertebra, okay. This is the site, and this is the procedure in the sitting position, okay, in between the L3, L4 or L4, L5, and lying position you have to do like this, okay. Now write what is lumbar puncture. So it is a one procedure mainly, or it is also called spinal tapping. Okay, means you collect the CSF for diagnostic as well as therapeutic. Okay, so what is the space L3 L4 or L4 L5? Okay, by this space you can get the CSF more easily. Okay, so you can pierce these all structures. First is your skin. Okay, then subcutaneous tissue, then there are ligaments present na, supraspinous ligament, then interspinous ligament, ligamentum flavum. Then you find the epidural space, dura mater, then arachnoid mater, then subarachnoid space. From the subarachnoid space you can find this CSF. Okay, and the location is L3 to L4 or L4 to L5. Okay, and the indication means what condition you supposed to do the lumbar puncture. First is meningitis or any type of CNS disease or subarachnoid hemorrhage, or in case of the spinal anesthesia. What is the indication of the spinal anesthesia? कहाँ पर दिया जाता है तुम्हारा ये spinal anesthesia? पता है क्या किसी को? LSCS में. ओके, सीजरियन सेक्शन जो होता है इसमें स्पाइनल एनेस्थेसिया दिया जाता है. और फिर लोअर पोर्शन में जो भी होगा मतलब ऑपरेशन वगैरह, इसमें तुम्हारा स्पाइनल एनेस्थेसिया दिया जाता है. ठीक है ना. तो you can give this subarachnoid space. Okay, so first is pierce the skin, subcutaneous tissue, fat. Then after the completing this all layers you can find this subarachnoid space. Okay, from here you can get the CSF. Okay, right. First, what is lumbar puncture? Now the write the layer of lumbar puncture. Means you can cross this all the layers, then in the subarachnoid space you can find this CSF. Then site, then indications. So that's all about the today's class. Okay.